Good morning to Dr. Nurshahirah. Our topic is Thalassemia. Our group member consists of Kueh, Zhi Ling, Adlina, and Nurshahirah.
Before we begin, please make sure each of you get a brochure. Now let's watch the video to understand what exactly is thalassemia.
Hello, my name is Dr. Carlo Oger, emergency physician for edexitvideo.com. In this video, we're going to talk about thalassemia, which is a blood disorder that is passed down through families, which is to say it's an inherited disorder. In thalassemia, the body makes an abnormal form of hemoglobin, which is a protein inside the red blood cells that carries oxygen. The disorder results in excessive destruction of the red blood cells, and that leads to anemia. Hemoglobin is made of two proteins, the alpha globin and the beta globin. Thalassemia occurs when there's a defect gene that helps control the production of one of these two proteins, and thus the term alpha and beta thalassemia. Alpha thalassemia occurs most commonly in persons from Southeast Asia, the Middle East, China, and those with African descent. Beta thalassemia occurs in patients of Mediterranean origin, and to a lesser extent Chinese, Asians, and African Americans.
Based on Vasudeva Murthy et al. 2015, there are about 1 in 20 Malaysians who are carriers of the thalassemia gene.
Each type has different subtypes. Both alpha and beta thalassemias include two major forms, thalassemia major and thalassemia minor. In thalassemia major, you must inherit the defective gene from both parents to develop thalassemia major. It is a recessive disorder. In thalassemia minor occurs if you receive the defective gene from only one parent. Persons with this type of disorders are carriers of the disease and usually have no symptoms. What are the symptoms of thalassemia? The more severe form of alpha thalassemia major causes stillbirth, death on the unborn baby during birth or late stages of pregnancy. Children born with thalassemia major, also called Cooley's anemia, are normal at birth but develop severe anemia during the first few years of life. Other symptoms include bone deformities in the face, fatigue, growth failure, shortness of breath, and jaundice or yellow skin due to the breakdown of hemoglobin.
Other signs and symptoms such as tachycardia, pale skin, dark hearing, and poor appetite.
Persons with minor form of alpha and beta thalassemias usually have no symptoms. Signs and tests. A physical exam may reveal a swollen or enlarged spleen, also termed splenomegaly. Red blood cells will appear small and abnormally shaped when looked under a microscope. A complete blood counter (CBC) reveals anemia. A test called hemoglobin electrophoresis shows presence of abnormal form of hemoglobin. Now, let's talk about thalassemia treatment. For thalassemia major, it often involves regular blood transfusions and folate supplements. If you receive many blood transfusions, you should not take iron supplements. Doing so can cause a high amount of iron to build up inside your body, which can be harmful.
After blood transfusion, iron chelation therapy will be done, and this therapy is needed to remove excess iron from the body to prevent iron overload, which can cause organ failure.
Bone marrow transplant may help treat the disease in some patients, especially children. What are the expectations or prognosis of this disease? Severe thalassemia can cause early death due to heart failure, usually between the ages 20 and 30. Frequent blood transfusion with therapy to remove iron from the body helps improve this outcome.
Complication of thalassemia. First is the heart disease due to the iron overload in the blood, such as heart failure, irregular heartbeat, and heart attack. Second is the second commonest cause of death in thalassemia major, which is the infection. It is due to splenectomy, transmission of pathogen through blood transfusion, iron overload, and iron chelation. Third is the osteoporosis, which is bone marrow expansion causes interruption in bone formation. And fourth, endocrine complications such as growth failure, diabetes mellitus, delayed puberty, and hypogonadism. Now let's watch the life of a kid named Alex who is diagnosed with thalassemia.
Thalassemia is an autosomal recessive blood disorder.
Thalassemia is an illness That's caused by the inability of red blood cells to produce hemoglobin.
We went to the 4-month checkup, and John Patelis, a friend of ours from church, who knows about thalassemia, looked at Alex and said he's hemolyzing, which I didn't understand what that meant.
It was a pretty devastating day, none to speak of.
It's a disease that affects children, like Alex.
1, 2, 3. Take a deep breath for me.
I think that I'm different by what I have to go through and how I deal with needles.
We'll take the little cap off here. Sterile needle.
Treatments for thalassemia include chelation, an intravenous medication that must be worn 12 hours a day.
And you'll see. It's okay. So leave it there like that. Oh, where's my other gauze?
There's a maturity to him, or a level that that most kids that age don't have, or either don't possess. I don't think he never acts different. You know, we've tried to make him as normal as possible, except for the fact that he has to go once a month to get his therapy, and then at night he wears his medicine.
And then pull it out the top, and then you won't even bother with it anymore. That'll be the end of it. And clip it. And that stays on until tomorrow morning. Right before school, we pull it out.
Patients with thalassemia must also receive blood transfusions every 3 weeks.
Chronic transfusion means the receiver of a red blood cell transfusion generally once every 3 weeks to 4 weeks in order to keep them from trying to make red blood cells and keep their red blood count up. The reason you want to keep them from making red blood cells is because your body wants to try to make the red blood cells, it just can't.
When I go to the doctor, I have to get a needle, and it stays in my arm for about 6 hours.
A blood transfusion now to me doesn't seem like such a big deal.
My doctor day is not very scary. It has a few scary moments when the needle's going in. 1, 2, 3.
The easiest way to help kids like Alex is to give blood regularly.
Sometimes we take for granted when we hear on the news that, or read in the newspaper, that there's a shortage of blood supply out there, and it's just it couldn't be more important to all of us who are able to give blood on a regular basis.
It's easy for me to come in here once a month and transfuse a patient with blood. But the real way that you need to understand this disease is think of your own child.
So I think it's really important to see someone else who realize how appreciative you should be, and it makes you realize that, you know, giving back like that is it makes you feel great, and you know you're giving life literally to someone else.
Now I'm going to talk about the dietary aspect for thalassemia. Thalassemia patients who didn't do chelation therapy should avoid food high in iron such as oyster, liver, pork, beans, and etc.
However, for transfused patients on chelation therapy, a low iron diet is not necessary as the iron has been removed through chelation therapy, and this may decrease the quality of life.
So here are some of the tips that the thalassemia patient should take note. First, do not cook with cast iron cookware because iron from the cookware can transfer into the food. Second, consumption of tea and coffee can decrease iron absorption. Third, alcohol consumption and cigarette smoking are to be discouraged. Alcohol potentiates the oxidative damage of iron and aggravates the effect of hepatitis B and C on liver tissue. Cigarette smoking affects bone remodeling and is associated with osteoporosis. Folic acid is a B vitamin that helps build healthy red blood cells. If you're taking a supplement, it should be 1 mg per day. Thalassemia patients should take food high in calcium. For example, 1 cup of milk, cheese, yogurt, 6 sardines with bones, and milk-based pudding or custard. This is because if thalassemia major is not treated with proper blood transfusions, there is so much activity in bone marrow that bones will become thin and will fracture spontaneously. The major problem that interferes with strong bones is hypogonadism. Without estrogen and testosterone, bones will not form normally, and later in life the bones will be susceptible to disease. Thalassemia patients should take food high in vitamin C such as citrus fruit, papaya, guava, and kiwi. This is because iron overload causes vitamin C to be oxidized at higher rate, which may cause deficiency. Too much of vitamin C ingestion may increase iron absorption from gut, thus supplementation of vitamin C is not recommended.
Based on Cunningham 2016, more fruits, vegetables, and whole grains is recommended, as this will enhance antioxidant, fiber intake, and also folate intake, which is very important for red blood cell metabolism. For the question, what is the youngest age for thalassemia children to undergo blood transfusion? Blood transfusion is done depends on type of thalassemia and its severity level. For pediatric thalassemia patients, laboratory and clinical findings must be taken into consideration. If the children is growing poorly and has developed bone abnormalities, and when hemoglobin levels are less than 7 grams per deciliter, regular blood transfusion will be beneficial for them. According to WHO, there is no specific age for blood transfusion among children. However, there are few indications for blood transfusion, such as hemoglobin level, hypoxia, and acidosis.
The last will be our reference. For further inquiries, you can refer to the reference here. That's the end of our presentation. Thank you for watching.